family physician in Oakville, and I'm the chair for the Halton Physician Association, and I'm the clinical lead for the primary care network development. And I have the pleasure of introducing Dr. Nivi Patel. She's a hospitalist at the Oakville Hospital, where she's been practicing for the last 12 years. And she completed her medical school and family medicine residency at McMaster University. And she also serves here as an assistant clinical professor, actively involved in clinical residency education. She has been conferred the designation of Fellow in Hospital Medicine by the Society of Hospital Medicine. In addition to hospital medicine, Dr. Patel is passionate about preventing and better managing chronic disease through a holistic, evidence-based approach. She completed fellowship training in integrative and lifestyle medicine and is American board certified in integrative medicine. She currently serves as the clinical lead for social prescribing with the Connected Care Halton Ontario Health Team, where she is helping to integrate social, lifestyle, and community supports into everyday primary care. She also leads the Oakville chapter of Walk with a Doc, organizing monthly community walks that promote physical activity, connection, time in nature, and accessible health education. So thank you very much with all of that to be able to fit us all into a lunch hour discussion. So I will pass things over to Dr. Patel.
Good afternoon, everyone. Thank you for the kind introduction, Dr. Martiniak, and thank you all for joining today's webinar. Today, I'll be talking about social prescribing and lifestyle medicine and how these approaches can improve patient health outcomes. We will also spend some time highlighting a few local social prescribing initiatives that our patients could benefit from. A few points before we get started. This webinar is being recorded, and just so there isn't any background sounds, we have muted everyone during the presentation. If you have any questions, I would ask that you please hold on to them until the end, or feel free to drop them into the chat box. We will have about 10 minutes at the end to answer questions as well. All right, so let's get started. So today's agenda, we'll be covering a few different topics. We'll start off by talking about social and lifestyle factors affecting health, and then talk about what social prescribing actually is and the rationale behind integrating it into healthcare we offer patients. And then we will go into some local community initiatives and how we can refer our patients to them. And finally, talk about some next steps and future considerations. So before we get into it, I just have an activity for all of you to get your thoughts on something. So it's just going to pop up on your screen. Should be coming up any minute now. There's a little bit of a lag sometimes. Does anyone see it yet, or?
We can see it, Nivi. People are responding. The word
Okay.
cloud is getting populated.
Perfect. That's great. And if you keep it open, you'll see what everyone else has shared as well. We'll keep this open for a while, or for a little bit longer. And if you have closed that poll, you can also go on the chat box or on the polls icon on the top of the screen, and it'll show up in a panel on the right. Yeah, some great responses so far. Access, compliance, yeah, health stigma, mental health, income, social supports, connection, meaningful relationships, yeah, exercise. Amazing. Those are all really great points. Okay. I think we have most responses here. Barrier to access is a great one as well. Food insecurity, yeah. Amazing. Those are great points. We can now get into the presentation. So as many of you mentioned in that word cloud there, you may have seen as well, there are lots of social factors impacting our health. These social factors are known as social determinants of health, and they can impact our health both positively as well as negatively. So as you can see here, this wheel has the 12 key social determinants of health factors. And these include things like income, social status, employment and working conditions, education and literacy, our childhood experiences, our physical environment, social supports and coping skills, healthy behaviors. Do people have access to health services? What's someone's cultural background, racial background, their gender, genetics? All of these factors feed into health outcomes. And then when we switch gears to lifestyle factors, we know that there's various aspects of our lifestyle, like sleep, nutrition, stress, physical activity, and many others that have tremendous impact on our health outcomes as well. Lifestyle medicine is a medical specialty that uses therapeutic lifestyle interventions as a primary modality to treat chronic conditions, including but not limited to cardiovascular diseases, type 2 diabetes, and obesity. Lifestyle medicine certified clinicians are trained to apply evidence-based whole person prescriptive lifestyle change to prevent, treat, and even reverse such conditions. There are 6 pillars of lifestyle medicine, and these are the different aspects of lifestyle. These include physical activity, restorative sleep, stress management, whole food plant predominant eating pattern, avoidance of risky substances like tobacco or alcohol, as well as positive social connection. One other pillar that I would call a bonus pillar is spending time in nature. We're seeing a lot of benefits to spending time outdoors in nature, and it can have significant impact on health outcomes as well. This form of medicine is a root cause approach to health, where the patient is an active participant in their healthcare journey. And just to highlight, the impact lifestyle change can have, I have a few studies that I wanted to briefly highlight here. So the first one here on the left, the graph on the left, is a study conducted by the Diabetes Prevention Program Research Group, which randomly assigned over 3,000 non-diabetic patients who are at risk for developing diabetes to 3 different groups. So there was the placebo group, there was the metformin group, and the lifestyle modification group. The placebo, and on the y-axis here, you can see there's the incidence of diabetes, and on the x-axis is the number of years progressed through. So what this study actually showed was the lifestyle intervention group had the most reduction in incidence of diabetes by 58% compared to placebo. So even more than metformin, which reduced incidence in the group by 31% compared to placebo. So that's quite it highlights the value lifestyle change can have. And then on the right here is a image from a case study series that was performed by one of the pioneers in lifestyle medicine, Dr. Esselstyn. So he's a cardiologist, and this is an image of coronary angiograms. And what he is showing here is the coronary angiogram of a distal left anterior descending artery of the heart. In 1996, and then 32 months later on a plant-based diet without cholesterol-lowering medication, we see here that there's significant improvement in blood flow. So there's reduction in plaque. These case studies prompted another pioneer in the field, Dr. Dean Ornish, to conduct further studies. So he has performed many different studies, but one to highlight was a study with over 4,000 patients, where there was the experimental group that had intensive lifestyle intervention involving a whole food plant-based diet, moderate level exercise, social connection, and stress management strategies, which resulted in sustained regression of coronary atherosclerosis after 1 year and further regression after 5 years in the experimental group. In contrast, in the control group, atherosclerosis continued to progress and more than twice as many cardiac events occurred. There were also, there were also other benefits seen, like reduction in blood pressure, cholesterol lowering effects, A1C improvement, as well as weight loss and mood benefits. So again, these are very high-level summaries of very few studies, but it highlights the power that evidence-based prescriptive lifestyle change can have in the context of chronic diseases. So just to switch gears into what the current state is in Canada, we do have quite a significant chronic disease burden. These are some statistics from Stats Canada. The most recent ones they had were from 2021, but essentially, about 45% of Canadians are living with at least one major chronic disease, with being overweight, obese, arthritis, and hypertension being the most common conditions. Heart disease and obesity rates are on the rise as well. We're also noting that chronic disease prevalence seems to increase with age, as we would expect, especially in the seniors group over age 65, and there's higher rates among women versus men. There's also some socioeconomic and racial disparities. I just have a couple here just to highlight, but lower income patients tend to have higher chronic disease burden and multimorbidity as well. And in the realm of mental health, it tends to be there's for people above the age of 12, anxiety and mood disorders tend to be roughly around 10%. In prevalence, and these stats are higher in women among First Nations individuals and those individuals of lower income bracket as well. So today I wanted to explore a form of prescribing that can help us address social and lifestyle factors as a means to lower chronic disease burden. This is something we're going to have to deal with even more as our population ages. And as physicians and healthcare providers, we do not always have enough time to counsel or coach patients on various aspects of lifestyle, and we certainly are not in a position to address social factors on our own. So social prescribing allows us to bridge that gap. It's a holistic, patient-centered approach to health and well-being that allows healthcare professionals to connect individuals to non-clinical supports and community-based resources. So it is a form that addresses root causes of health issues like social isolation, financial challenges, food insecurity, mental health concerns, as well as need for movement or community connection. It helps us bridge the gap between clinical care and community resources. And, social prescribing can benefit anyone really, but is most helpful in people with a high burden of social or systemic factors that impact their health negatively. So things like loneliness, low income, limited mobility, multiple chronic diseases. These are the individuals that'll benefit from it even more. So I have another activity for all of you. It should pop up as well very soon. And so I just wanted to gauge how are you already implementing social prescribing in your practice? If you are, and what are some of the ways that you are doing so? Give everyone about a minute to put something down. That's great. Yeah, I see referral to One Link, PRX, the Nature Prescription Program, community supports, yeah. Alzheimer's Society, yeah, that's great. Income support, formal prescriptions, yeah. Community organizations and supports, yeah, that's great. Amazing. Thank you all for sharing. Okay. So a little bit of a busy slide, but I wanted to touch on, the data around social prescribing and why it matters, why we should really seriously consider incorporating this into our practice. So just a high level summary, there's a lot of different studies that have happened in different locations worldwide. There's some good evidence coming out of the UK, as well as some global findings and some studies in Canada itself. One of the systematic reviews of 7 studies showed that those individuals who engaged in social prescribing, 48% of them reported more frequent physical activity, 20% reported improvements in their health status, and 23% reported improvements in their health confidence. Locally here in Calgary, the Way in Network study findings showed better patient experience and health equity. So 76% of those patients felt less lonely and isolated as a result of engaging in social prescribing. 83% felt the program helped them access needed community services, and 76% reported improved communication with their medical team. And then there was also a recent analysis of potential economic and social impacts of social prescribing done by KPMG, which was released in July 2024. And the two social prescribing again benefits everyone, but the two populations where it's shown a lot of good data is the older adult population as well as the youth. So among older adults, this KPMG analysis looked at existing data and made some projections, which are quite impressive, actually. They found that if social prescribing is adopted, you'd see an estimated sorry about that, an estimated 250,000 fewer hospital days annually due to fall prevention, almost 50% lower risk of dementia among patients, and then expected about 17,000 fewer cases of coronary artery disease, 7,600 fewer cases of dementia in the next 10 years, and 6,500 fewer cases of stroke over a lifetime. So quite impressive projections. And then with respect to reducing healthcare costs and system efficiency, some data out of the UK showed, one of the CHCs did some studies, and they found that there was a 5% reduction in unplanned inpatient stays and 26% reduction in ER visits among older adults. And the KPMG analysis also found that every dollar invested into social prescribing programs may return $4.43 to the society through improved well-being and reduced costs incurred on the health system itself. So overall, I mean, the data shows that social prescribing supports aging adults, leading to fewer hospital admissions and emergency visits. It helps tackle loneliness and isolation across all age groups. There's significant healthcare savings and improved overall well-being. And finally, there's the bonus of benefits to our environment. When we reduce demands on our healthcare system, we also make the healthcare system more environmentally sustainable. And specifically, prescribing nature, which we'll talk about later, can also promote pro-environmental behavior and attitudes, which is another kind of downstream benefit. I also wanted to touch on the quintuple aim in healthcare. So social prescribing has a significant potential to actually improve health systems within the dimensions of the quintuple aim. Not sure if you've all heard of this, but this quintuple aim is a set of 5 interrelated and reinforcing goals for individual well-being, community health promotion, and health systems improvement. And this includes, improving patient experience, improving population health, reducing healthcare costs, improving our healthcare team well-being or the provider experience, as well as advancing health equity. So, lots of large-scale benefits that we can see through social prescribing. Now, I wanted to switch to talking about some local initiatives. This is in no means meant to be exhaustive. There's a lot of community resources and programs. But just as some examples, I wanted to highlight 3 programs today and how we can refer our patients to them. So the 3 we'll be talking about is PRX, or the Nature Prescription Program, and Conservation Halton Partnership. And then the second one is Walk with the Doc, the Oakville chapter. And third is Small Steps, Big Changes, run through the YMCA Oakville. So before we talk about these, I wanted to get a sense from all of you, which of these initiatives have you heard about or referred your patients to? It's going to show up in the polls again. Amazing. I'll give everyone another 15, 20 seconds or so. Don't know if everyone can see the results. Yeah, okay. Seeing some nods. Great. So it looks like 33% or so have heard of PRX. It's 34% have heard of Walk with the Doc. Small Steps, Big Changes, about 15%, and 20% have not heard of any of these. So that's good because we can talk about them. Amazing. So let's talk about PRX first. So PRX is Canada's first national evidence-based nature prescription program. So it encourages healthcare providers to prescribe time in nature to improve their health and well-being. It offers personalized nature prescriptions, and there's also collaboration with Parks Canada for discounted or free access to parks. So, I mean, why prescribe time in nature? We certainly don't have time to go into all the evidence behind spending time outdoors. But there are lots of research-backed benefits. To name a few, time spent in nature can reduce stress, anxiety, and depression. It's known to be able to lower blood pressure and improve our cardiovascular health, and also enhance immune function and promote overall well-being. The recommended dosage for nature is a minimum of 2 hours per week for measurable health benefits. So our recent partnership took place between PARX, Conservation Halton, CCHOHT, and Halton Healthcare to improve patient access to nature. Patients issued this nature prescription can actually get 10 free visits to Conservation Halton parks. So how can you actually prescribe this to patients? So step one is to actually sign up as a provider. And we can do so by going on parkprescriptions.ca. And there's an icon on the top right corner which says register as a prescriber. It's really simple. Once you click on that, you just fill out information and you get an email within 24 hours or 48 hours with a unique provider code and a prescription copy. So all of that whole file comes to you. And then you can actually write a prescription to patients that you think would benefit from it. So it doesn't have to say conservation Halton or anything, but it just has to sort of, you want to be as specific with your recommendations and try to align them with what the patient would enjoy. Spending time in nature could involve hiking, could involve running, could involve, simply, meditating in nature. The goal is to just surround themselves with nature. So once patients get this prescription, they can go onto the Conservation Halton website, scroll, and then that website's here. And then you can scroll down to PARX, click on PARX request form. The patient can fill out that form, and then once they do that, they will get a 10-visit coupon by email. And in case anyone has more specific questions around this program, we do have Craig, who is the director at Conservation Halton, who has kindly joined us and is here to answer any questions at the end. So thanks again, Craig, for joining. That's parks. And now we'll talk about the next local initiative, Walk with a Doc. So Walk with a Doc is a nonprofit initiative that was started in 2005 by a cardiologist, Dr. Sabgir, who was sort of frustrated in terms of finding ways to have his patients exercise and engage in physical activity and make it more fun. So he trialed this, and it really gained popularity, and it's sort of a worldwide initiative now in many different communities. And it involves free walk events, including a brief health discussion led by a physician, followed by a community walk. And it's also open to all people of all ages and abilities. So we launched the Oakville chapter in collaboration with CCHOHT and Halton Healthcare. And our goal is to encourage more community members to engage in physical activity, offer evidence-based health education, promote social connection and time in nature to reduce the burden of chronic disease. So how we can refer patients, it's very simple, really. If you feel that you have a patient that can benefit from attending these walks, they're monthly, they happen on one Saturday of the month, and they usually start in downtown Oakville. And many times we walk by the lake. So, just explaining the benefits of this program, and then referring them to the Walk with the Doc Oakville webpage. And that's where we have all the dates and times and locations for the walks. And finally, another program we wanted to highlight as well is the Small Steps for Big Changes, which is run in collaboration with the YMCA Oakville. So this is a free evidence-based counseling program to foster sustainable diet and exercise changes to lower type 2 diabetes risks. And it's focused on pre-diabetic individuals. And what it involves is 6 coaching sessions over 4 weeks. And there's also check-ins after these 4 weeks are complete at the 12-month mark and the 24-month mark. People also get a 1-month free gym membership to encourage physical activity. In terms of the impact they've had so far, out of over 400 patients enrolled, 85% of those no longer have prediabetes, and none of them progress to type 2 diabetes based on hemoglobin A1C scores 1 year after completing the program. There was also noted increased physical activity and healthier eating habits sustained months after the program, and improved fitness level, reduced blood pressure, and reduced weight and waist circumference as well too. In terms of eligibility, patients would be eligible if their hemoglobin A1C falls between 5.7 and 6.4%, or if their American Diabetes Association risk score is 5 or more, and as long as they're medically safe to exercise. In terms of referring patients, again, it's very simple. You just point them to the YMCA Small Steps, Big Changes website, and then they fill out a short questionnaire there, and someone from YMCA will reach out to them. So really straightforward. Yeah, and that concludes the local initiatives we have in our area. Just a few thoughts around next steps and future considerations that we'll be hopefully working on over the years with CCHOHT and community programs in our area. So first thing would be our goal is to help build a directory of local social prescribing options for providers and patients. We would like to expand partnerships with community organizations and services. Also hoping to be able to strengthen mechanisms for patient feedback, needs assessment, and ongoing program evaluations, as well as ongoing dissemination of key information to reach more providers and patients. And finally, we're planning a lifestyle medicine webinar or in-person series. And the goal of this is to build on most current and practical evidence-based lifestyle interventions to complement the care we provide our patients to improve health outcomes while also improving provider health and well-being. We will cover topics like gut and microbiome health, women's health, optimal nutrition for disease prevention, as well as do deeper dives into those 6 or 7 pillars of lifestyle medicine and what the reasoning behind those are. So we will send out a survey to gauge topics of interest and need via email over the next couple of weeks or so. So please stay tuned. Yeah, and just to conclude, a few key takeaways. Social determinants of health and lifestyle factors play a key role in health and well-being. Lifestyle medicine emphasizes the importance of lifestyle change in preventing, treating, and managing chronic diseases. Social prescribing is an effective means to address both social and lifestyle factors to bridge the gap between clinical care and community support to enhance health outcomes and reduce disease burden. And local initiatives like PRX, Small Steps for Big Changes, Walk with the Doc, are will impact on individual and community health. So we hope to be able to, really tap into more such resources and connect patients appropriately. And that concludes my presentation. Here are some references I used, and I just wanted to thank you all for joining today. We do have a survey. If you could kindly fill that out as well through this QR code, it would really help inform future events and get your feedback too. And if you have any questions, we can open it up for that.
Before we go to questions, I would like to thank Dr. Patel so much for all of her hard work putting this presentation together. I know I've learned a lot, and I'm really excited about the future in terms of what we can offer for our community and the talk series coming up. And I really thank the OHT staff. We couldn't have done this presentation nor plan for our future events without this. So thank you very much. And I see I'll have a look at the chat as we go along in case questions pop in there, Nivi, and I can see that there's 2 hands up, which you can probably see as well. So
Yeah.
you can just go to the hands and I'll interrupt if there's questions in the chat.
Awesome. Let me.
So David,
I think David was first.
Yeah.
All right, thank you very much. Great presentation, Dr. Patel. Thank you very, very much. Again, I'm David. I'm the Education and Wellness Manager for the Alzheimer's Society, Brant, Haldeman, Norfolk, Hamilton, Halton. Just wanted to put out there that we are currently testing a social prescribing pad with family docs. It's an opportunity for, well, what we've heard is, again, early support of brain changes with people or dementia, trying to get them engaged with the Alzheimer's Society earlier. So to utilize this pad with some of our social programs on it to engage people earlier. And again, really impressed too with the information you shared about the dementia, lowering the dementia risk through social prescribing and these programs. So I just wanted to put out there today, if anybody is interested in the Halton area and working with the Alzheimer's Society, I'm going to put my email address in the chat. And if you're interested in testing our social prescribing pad and utilizing it for possible early conversation around brain changes, I'd be happy to work with you. And particularly, we are looking for some support in Halton. So thank you.
Amazing. Thank you for sharing. That's really great that you've put that together. Yeah, thank you. Please share your email address. And then I think it was Noor next.
Hi, good
Hi.
afternoon. Yes, my name is Noor, and I'm working with HMC Connections, which is a non-for-profit organization in Halton area. And we have just started a new initiative, which is Wellness Navigation Program. And like part of our initiative is education and, just, bridging the gap. So I'm interested in knowing more like about community partnership, like how can we do that? What are the steps? If there anything we can do, we can initiate some programs. So if anybody I can connect with who can, guide our organization if we want to be one of the community partners.
Amazing. Thank you, Noor. We can likely connect offline on that.
Yes, I think so. Noor, if you're able to provide us with a contact email, then someone from the OHT can reach out. And there is a question in the chat about social prescribing for family, I think, and caregivers, family caregivers. So are there any options for social prescribing for family caregivers?
So I might defer that to one of our project managers at CCHOHT.
Yeah, absolutely. I can step in. I think the effort for our OHT at this point, as we look to scale and expand social prescribing, is to look at all the different initiatives that exist pertaining to social prescribing that a lot of the great organizations are doing. You just heard from David. I know Links to Care, Nucleus, and all these other community organizations are doing these pieces. Our effort would be to bring all of these pieces together into one social prescription strategy under OHT and to make sure that it addresses and connects with patient families and caregivers and other populations as well. That said, I think if you reach out to me directly, I can definitely help navigate you to some organizations that I know are doing some work with PFCs, and hopefully that would help you get connected.
And I think we have another hand up. Lakveer.
Yes, Dr. Patel, thank you so much. My name is Lakveer Sandar from Punjabi Community Health Services. I connected with Mateen and Jade. So you did mention a couple of things with studies with South Asians and the weight, 44% overweight rate. What we're noticing in Punjabi Community Health Services is the stigma. So social prescribing, there's going to be a major issue with the growing population in Halton region. We're noticing that with our clients with mental health, when we discuss things, we try to give them psychoeducation. But this is going to be super wonderful, like a great resource. So I really appreciate you backing up a lot of this. So it's evidence-based. But there's still going to be our major barrier will be there's just a lot in this community. So if anybody wants to connect with Punjabi Community Health Services, and I appreciate you giving that South Asian study as well. And is there anything else that you're noticing with our community? We only have a couple of minutes, but with the South Asian Punjabi community, did you notice from your studies that, or the references, the resources, that what are the barriers for our community?
So I don't know if we have kind of time to go into all of that right now, but there's definitely lots of, there's overweight, but then there's also a lot of cardiovascular diabetes risk and incidents in the South Asian community. Barriers wise, specifically, I haven't looked into kind of all the specific barriers. And I don't think we have all the time to go into that as well, but I think stigma is a big one for sure, especially as it pertains to weight. Yeah, so I mean it's a great. I'm glad there's a community health services focused on this community and focusing on specific health needs. Thank you for sharing.
Nancy's next there.
Oh. Yeah, Nancy. I think I just have to.
Nancy, you just have to unmute on your end. There's a microphone shaped icon. I think it might be near the top right hand of your screen beside a camera shaped icon. And if you just click that.
Do you want to put your question in the chat box if it's not working?
And while Nancy's doing that, I see that there's a number of contacts being added to the chat. So Jade or Mateen, are we able to capture all that information afterwards? Perfect.
Amazing. Did anyone else have any other final comments or questions while Nancy's typing?
There's lots of great comments in the chat, but I don't see any as specifically being questions at the moment.
Okay.
But lots of opportunity to connect with different organizations and regarding certainly directory, but more than that, perhaps as well as we work together.
Yeah, Nancy's question was, do all of the activities have to be prescribed or say walk with the doc open to anyone? Yeah, they can be self-referral. So walk with the doc as well as small steps, big changes are, patients can self-refer. Yeah.
Just the PRX, if they want the 10 free passes, that's where a connection with a physician and the physician signs up for the program. That's the only piece that you would need a prescription for.
Anything?
Well, I think we're at time.
Yeah.
Yeah. So
Thank
thank you
Thank
again.
you. Yeah. Thank you, everyone. Thanks for joining. And thank you to the CCHOHT team, Mateen, Jade, Sarah, and Zoe, who helped with this presentation as well.
Have a great day,
Thanks,
everyone.
everyone.
Thank you, everyone. Appreciate it.
Please
Take care,
fill
guys.
out the survey if you haven't already. Would be very, very helpful.
Okay, I guess that's it. We got some stragglers, but do you want to hop off,
Stop
Nivi?
sharing.
And
Yeah,
just
yeah,
okay.
yeah.
Do you
I'm just
want
gonna
to?
close this. I'm just
Okay, perfect.
turning this off. Okay.
Would you like to debrief in another
Sure.
meeting? Sure. Okay, let me send you something right now.
Okay.